Yes. So, very good evening and namaste to everybody for joining us today. This is the episode 6 of the BNSK Bharat Samvad, which is policy dialogue series for inclusive India. And we have very profound and I'll say the eminent academician with us today, the Professor Shantesh Kumar Singh, who is currently serving as an director for the human rights and security policies at School of International Studies, and also the professor at the Center for International Politics and Organization and Disarmament at the SIS JNU. So he will be delivering the keynote address for this global health equity through India's traditional wisdom. Like you might have heard about, there is a one sloka, I'll say, from the Taittiriya Upanishad of the Yajur Veda, if we talk about the Indian knowledge system, Indian ancient wisdom. So, Sarve Bhavantu Sukhine, Sarve Santu Niramaya, Sarve Bhadrani Pasantu, Ma Kasjit Dukh Bhag Bhavet. So, means sabhi sukhi ho, koi bhi dukh na dekhe. So, we have all those things in our Indian knowledge system. So, how these Indic lenses can solve the contemporary challenges in respect to the global health equity. So we have very profound professor with us today. So I request Nandini to give a brief introduction about the professor so that you will be having the idea that how this session will be assisting you in academic aspect. So Nandini, please proceed with the today's introduction note for the professor Santesh Kumar Singh. Yes. Nandini, am I audible to you?
Yes, sir, definitely.
Yes, yes. Please proceed with it.
Just 1 second. Sir, am I audible and visible?
Yeah, you are audible and visible.
Yeah,
Yes.
you're audible.
Got it. So, it is with immense pleasure and great respect that we extend a warm welcome to Professor Shantesh Kumar Singh, our distinguished keynote speaker for episode 6 of BNSK Bharat Samvad Policy Dialogue Series for Inclusive India. Professor Singh is currently serving as the Director, Human Rights and Security Policies, School of International Studies, and Professor at the Center for International Politics, Organizations and Disarmament, Jawaharlal Nehru University, New Delhi. He also holds esteemed international affiliations as an adjunct fellow at the International Association of Counterterrorism and Security Professionals, Kuala Lumpur, and managing editor of the NCTN IACSP Journal of National Security and Terrorism based in Helsinki, Finland. We are truly honored to host Professor as he delivers a keynote address on the highly relevant and timely theme Global Health Equity through India's Traditional Wisdom. With his extensive academic and policy experience in international relations, security studies, and geopolitical strategies, Professor Singh brings a multidimensional perspective to the dialogue. His insights into how India's rich and ancient traditional knowledge systems can contribute to the global discourse on equitable healthcare are not only intellectually stimulating, but also vital in shaping an inclusive, resilient, and culturally rooted health policy framework. On behalf of the entire team at Bharatiya Neeti Samvad Kendra, we express our heartfelt gratitude to you, Professor Singh, for joining us today and for enriching this dialogue with your visionary ideas. We look forward to an enlightening and inspiring session. Welcome to Professor Singh.
Yes. So
Thank you, Nandini. Thank you so much.
I
Thank you.
request a professor to put their valuable insights on the how global health equity can be seen through India's traditional wisdom and how it can solve the contemporary challenges. So, Professor, please proceed with your lecture for today.
Am I visible in the
Yeah,
screen?
you are not visible. Uh,
That is the issue I am trying to resolve actually.
yes, 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 yes. Yes,
Now,
Professor. Yeah, you are clearly visible. Yes, yes, yes. Namaste. Please.
namaste, namaste.
Yes, yes.
It's okay now?
Yeah, clearly.
Am I visible now?
Yes, you are visible and
Oh,
audible. Yes, please.
okay, thank you, thank you. So, uh, this is matter of pride for me to be here with you all. A very good evening to all of you. And I extend my special thanks to Amanji for inviting me to allowing me to share my ideas and views on this very important and contemporary topic, which requires to be discussed, in all the institutions, considering nowadays an important topic, because health is becoming issue which have multiple dimensions. You can't keep it restricted within a no health specialist or basically those within uh, the parameter of those given definition of medical practitioners kind of thing, because it is moving beyond that boundary actually. Now people who are working on history, they are also discussing about what kind of health history have been passed. Those who are working on national security, they are also keeping health in center nowadays, as we all are experiencing this infectious disease kind of threats, like uh, states are where states are failed in delivering uh, services during these kind of threats, or basically infectious threats, which are rising up because of these kind of diseases like COVID-19, Chegas, Ebola, SARS, COVID, and multiple kind of diseases are coming in front of us, and we all are trying to cope up with this challenge. And this is no matter of something associated with a particular set of countries which are known as developing countries or least developed countries. Basically, it is something associated with all the countries across the globe, which claims like they are having best medical facilities in their country. They have been failed in last COVID crisis. We all of us have witnessed how these states have been collapsed in past. So the subject is here: what kind of equity we are going to deliver to people across the globe, and which institutions we are going to have in the days to come, which will address all the requirements, all the needs of people in with this equity subject. Basically, this is what we are talking about. If you want to keep yourself protected and safe by by providing all kind of facilities or amenities to your own people, that is not sufficient. This is the time when you have to keep all the countries engaged in deliberations, dialogues on such issues, right? You have to keep all the countries in one basket. Then only you can resolve such issues. You can't keep it, keep yourself in isolation by saying this is something associated with A country, B country, and that is not associated with us. And as we all are knowing, like this is the age of globalization where people are migrating from one region to another region, from one country to another country within ours. So at the same time, these kind of diseases or the basically uh, in simple word, it can any kind of disease can travel from one region to another region within few hours. So there's nothing like you can stop. Like we don't have a strong mechanism to check the spread of such disease across the globe. So what kind of system we all are evolving with, basically what kind of global governance we are going to have in the days to come, because whatever system we are having, that is what we are having from WHO only, right? World Health Organization. That is one of the most important prominent global health governance, basically. So within that, we are having international health regulation. That is one important component that works for global community. At the same time, we should understand, and that is what we got to understand. We have to fight, at two level: domestic level and international level. And the subject is very much who lives within a border, within a country's border. Basically, they deserve, they require, they are they are demanding for equity. They are asking their voice for equality. Even that subject has become very much global in nature. Means all the countries are very much concerned to provide basic amenities in terms of health, basically, to all the people. Is not very much restricted within borders or basically within the regions. Now it has crossed the border. If I could define what global health equity is, then I would like to refer to the fair distribution of health resources and opportunities, ensuring that everyone can achieve their full potential for health and well-being. And global health equity is not just about providing access to healthcare services, but also about addressing the underlying social, political, and economic conditions that contribute to health inequality. Because while uh, Nandini was giving my introduction, and of course Aman has also given introduction about my achievements. They missed one thing, like my most of work is on health. Like I did my PhD health. I worked with one of UN institution, International Institute for Health, where I worked on global health governance issues. Even still, I am working to more research on basically such topics, and in that way, I am very much thankful to Aman again for providing me this opportunity to share my ideas with all, and definitely providing opportunity to enhance my knowledge on this very important and relevant topic basically. And the title, I would like to share here another important fact. The title has been given to me by Aman. So Aman, very much thankful to you. I got several messages on this particular topic. The topic you are going to speak on is very relevant and very important, and you should keep continuing working on this basically. In that way, I could say this is very relevant for all the scholars who are working, who are planning to work on health issues. So because terms are changing. Earlier it was very much associated with national health kind of thing, yeah, local health or state centric health systems, but now we are talking about global health equity that has become global. It's not like local now. It become global. So all the countries, all the people, all the experts, all the people involved in different areas have started talking about global health. So global health equity is not just about providing access to healthcare services, but also about addressing the underlying social, political, economic conditions that contribute to health inequalities. That's why we had basically one an important goal within Millennium Development Goals. And again, Sustainable Development Goals. It's important component of Sustainable Development Goals, Goal 3. That is what we all are talking. And the main objective, the core of Sustainable Development Goal is that good health and well-being. That is there actually. So it transcends the traditional health wisdom of disease treatment and emphasizes reducing disparities through inclusive, context-sensitive, and sustainable health system. Despite growing technological advancements, modern healthcare, cultural disconnect all the countries across globe, especially those who are poor in terms of having basic amenities with this health issue. So as the global health community grapples with chronic diseases, disease burdens, mental health crises, and healthcare inaccessibility, the relevance of alternative community-rooted models has become increasingly evident. And of course, I'm going to define all these points in, later. Then what is this traditional knowledge systems and why, how that is going to link with this particular subject or issue? Basically, that is what we require to understand. Traditional knowledge systems are time tested, community rooted health practices developed over centuries through observation, experience, and cultural transmission. This is very important to understand. And in ancient times, you can have several practices which have been more successful than what we are practicing here in 21st century. So the time has come, we have to go back into past to explore all those practices which have been very relevant to making basically a world disease free. So the time has come, we have to talk about freedom from disease, right? Freedom from want, freedom from hunger. This is important. At the same time, freedom from disease is also important. To fight against diseases, we have to explore all the way out. So modern health practices or modern medical practices, that is relevant. I'm not going to deny that. At the same time, we have to go back in past to find out what kind of practices we have practiced in past, basically, because those were very relevant that time, and how those were relevant, or how they were successfully basically achieved their very defined kind of practices at that time, and they saved millions of life at that time, where they did not have such modern kind of medical systems. So we have to explore all those systems. So these systems are inherently holistic, the emphasizing not just the treatment of illness, but the promotion of overall well-being, spanning physical, mental, emotional, and environmental health. All these issues were interconnected. We can't separate it. Like physical health is something different from mental health something different from emotional. Yes, for treatment that is okay. There's a set of doctors who are expert in mental health. It doesn't mean they are not knowing about other things. So there should be proper coordination in practicing, in elaborating, in doing research on such issues. So, unlike contemporary biomedical models, I'm defining it, TKS, which now known as traditional knowledge systems, focus strongly on prevention, balance, and harmony with nature, making them especially effective in low resource settings where infrastructure is limited but local wisdom is abundant. So this is what we are requiring to look into basically at this by discussing this particular topic. How those countries are coping up with these kind of challenges. Which country have no these modern kind of amenities available. So how they are fighting against such threats, how they are fighting against such diseases, how they are keeping their own people safe from such diseases. This is what we are trying to explore, and that only can be explored through this IKS, right? TKS, traditional knowledge system. Indian nowadays India is also exploring that Indian knowledge system, and Indian knowledge system is quite broader. Within that traditional knowledge system is one of the important component within that actually, right? So one prominent example is Ayurveda. That is what we all are listening here in India, which views health as balance among body, mind, spirit, prescribes lifestyle modifications, herbal remedies, and dietary routines tailored to an individual's constitution. Prakriti. That is what we quote it here is Prakriti. That is what very important component here in India. We always respect when what kind of whatever kind of basically practices do we have basically in social life that is very much close to nature. That is very much close to Prakriti basically. So Prakriti is one important core issue within that entire discourse of this traditional knowledge system basically. So prescribes lifestyle modifications, herbal remedies. So this is what we have to like nowadays in India, particularly. I'm talking about what practices we had in past and whatever we are having here in present basically in terms of herbal remedies that is getting attention of global community across the globe. All the countries are getting influenced towards India's this herbal practices, herbal medicines basically nowadays. The Ayurveda is also part of that. Other things also like traditional Chinese medicine. I'm not going to restrict ourselves within this Indian practices. There's other many practices which we require to explore on basically we explore to basically like traditional Chinese medicine, widespread in East Asia, diagnostic techniques such as pulse reading and treatment methods like acupuncture, emphasize restoring the body's and energy flow. Ubuntu no medicine that is very famous in African continent. African cultures integrates communal care and ancestral guidance, reflecting a collective approach to healing that strengthens social bonds alongside physical recovery. So we have discussed Ayurveda here in India, traditional Chinese medicine, and Ubuntu medicine. This is all known as traditional knowledge systems in health, basically. And then we come to basically India. India's traditional wisdom spectrum, what India is, and how India thinks about India's boosts the rich traditional medical heritage with systems emphasizing holism, prevention, and nature-based healing. Here I'm going to give you some very core component of that, ancient Indian medical manuscripts, Rig Veda. That is an important manuscript which talks about many of the issues which direct has no concerns with health, basically. Therapeutic use of 67 plants that talks about. Yajur Veda, enlisted use of 81 plants. That is what described in Yajur Veda. Athar Veda, enlisted 290 plants of medicinal utilities. Susrut Samhita mentioned use of 395 plants. How that helps basically in prevention of such kind of diseases. Our Charak Samhita describes 341 medicinal plants. Dhanvantri Nagantu enlisted many medicinal plants. This is what I have given a very brief and glimpse of you know uh, uh, plants which have been discussed in different basically manuscripts available to us here in India. So the IU system that is latest, discourse going on here in 21st century, that is becoming one of the important pivotal actor in this our basically modern health system, basically IUs. Four major officially recognized system, which also known as traditional medical system, is Ayurveda, Yoga, Siddha, Unani, are regulated and promoted by the Ministry of Ayush. Ayurveda, Yoga, Neuropathy, Unani, Siddha, and Homeopathy. This is what combined as traditional medical system, traditional knowledge system on health basically, and mainstream traditional knowledge systems in public health. Ayurveda, it focuses on healthy living rather than the treatment of diseases and personalizes the process of healing. This is what nowadays all doctors are prescribing all the patients. So this is important, how to live a good life, basically, how to live a healthy life, basically. So lifestyle diseases are coming up because of we are not so much concerned about lifestyle, what kind of lifestyle we are living in, basically. We are eating food at 10:30, sleeping at 1, waking up at 10 a.m. So these kind of things are disturbing a lot your cycle, body cycle. So in that way, this Ayurveda is one important document, important manuscript available to us. And Siddha, it involves the identification of causes. What causes are there for diseases, basically, which involves the examination of pulse, urine, eyes, study of color of body, tongue. By going to that, doctors who are involved in Siddha, basically, they can understand what kind of problems you're going through, basically. They can provide a lot of medicines and a lot of suggestions, a lot of exercises to you to get cured from that particular disease, what you are going through, basically. Yoga and naturopathy, yoga and that big focus on bringing harmony between mind and body for healthy living. This is what global community has accepted to understand what kind of diseases are there.
Professor, you are not audible. Uh, just wait a minute, guys. There might be some network issue at professor's side, because just wait for a few more minutes. Just let him rejoin, please. Yes, yes, Professor, you are visible clearly.
Yeah, okay.
Yes.
We lost connection actually in between.
Yeah, yeah, definitely. So
So
we
Unani originated in Greece. It focuses on temperament of the individual as it is considered unique. Homeopathy originated in Germany. It is based on natural law of healing. And Soa Rigpa, it focuses on maintaining the balance of 5 elements: Prithvi, Jal, Agni, Vayu, and Akas in proportion to maintain a healthy life. So currently, the mainstream healthcare system is mostly constituted by the conventional modern medicine and public health framework. However, globally, the landscape of traditional medicine has shown an upsurge in recognizing its significance and potential for public health, and many countries are successfully implementing it into the respective national healthcare systems by developing national policies. This is what we all are experiencing across the globe. India has launched this and introduced its national health policy in 2017 recently. I'm talking about this present government, NDA government, Modi government. They have introduced new national health policy in 2017, regulatory frameworks, and this is not the case of India. Even all the countries across the globe are having new, basically health policies, and that is very much in line of sustainable development goals too. UN sustainable development goals. If all these countries are trying to acquire all the goals of UN, they are supposed to have new health policies, or they are supposed to upgrade or revise their existing basically health policies. And that is the case of all the countries which are member of UN in that. And strategic plans for traditional medicine products, practices, and practitioners. Studies found that 65% of population in India, I'm just quoting important fact here, 65% of population in India, especially in the rural areas, use Ayurveda and medicinal herbs to meet their primary health care needs. आप लोग जरा याद करिए, दिस इज वेरी इंपॉर्टेंट. गांव में आपको चोट लग जाता है तो इम्यूनिटी क्या होता है? हल्दी बांध दिया जाता है, हल्दी को दूध में डाल के पिलाया जाता है, तुलसी आपको दे दिया जाता है, नीम का पत्ता दे दिया जाता है. दीज काइंड ऑफ प्रैक्टिसेस वी आर हैविंग इन विलेजेस इन रूरल एरिया, एंड दैट इज वेरी कॉमन. जब तक आपको कोई बहुत बड़ा कॉम्प्लिकेटेड इशू ना हो, आपको रिकमेंड नहीं care. So these kind of things we are experiencing here in India. The most of population here in India are practicing that Ayurveda and herbal medicines. So why they are doing so? Because they are getting benefit of this using of these kind of medical herbals. So low resource settings, affordability and accessibility of India's traditional wisdom. This is what next I am going to speak on. In low resource settings, characterized by limited healthcare infrastructure, low health literacy, and constant public health budget, traditional knowledge systems like India's Ayush, Ayurveda, Yoga, Naturopathy, Unani, Siddha, and Homeopathy offers cost effective. This is important. Just try to explore the fact basically. If you're visiting a modern health, facilities like hospitals, big hospitals, how much they charge you. Just imagine if you are admitting in big hospital for 1 2 days, what charge usually they ask you to pay. That is huge. But while that compare that with basically or this Ayush kind of traditional knowledge systems, we charge very less, like cost effective, accessible, and culturally relevant solutions to pressing health challenges. And the best available option we have is basically Ayush. One of the most notable efforts in this regard is the Indian government's initiative to establish Ayush Health and Wellness Centers under the broader National Health Mission and Ayushman Bharat program. These centers aim to integrate traditional medicine with modern primary care services. This is what government is doing. This is what present government is focusing on basically. Government is trying to develop hospitals where both kind of systems work together, like modern medical systems at the same time traditional knowledge systems on health basically of health practices. As of 2023, over 12,500 Ayush HWCs, which known as wellness centers, have been operationalized across India, offering services such as lifestyle counseling, yoga sessions, herbal medicines, and non-communicable diseases screen, often at no cost to the patient. This is important, no cost to patient. There's no charge of these kind of services which are available to people free of cost basically. And that is being provided by Government of India. These centers are staffed by community health workers trained in Ayurveda who bridge the gap between traditional and biomedical approaches. For instance, I'm just going to give you a very important example. In Chhattisgarh and Uttarakhand, states with large tribal populations, IU centers have seen wide uptake due to the familiarity and trust the communities place in traditional healing methods. This is what happening. This is the real thing. The people are preferring basically these practices rather than going to medical colleges or hospitals. The modern hospitals are basically uh, costly, health services. They are not trying to avail those services. They are trying to avail free of cost services, which is being provided by Government of India free of cost, basically. Similarly, yoga-based therapy is being integrated into the daily routine of the school children. This is what all the schools are being directed to have in their school, yoga therapy. Senior citizens through mobile IUs units, especially in remote Himalayan villages. In Himalayan villages, basically, they are being provided all kind of help in terms of Ayush, in terms of traditional knowledge systems on health of practices, health practices, basically. They are being provided. Moreover, telemedicine platforms powered by the Ministry of Ayush, such as the e-Arogya Bharati portal, this is important portal developed by Government of India, have expanded the reach of these services to under-reserved populations. Patients in rural Bihar and Nagaland can consult Ayurvedic practitioners virtually. This is what government is trying to come up basically for the people, to assist the people basically who are based in very extreme areas of India basically, who are based in Nagaland, Arunachal Pradesh, Uttarakhand, Himachal Pradesh, in remote areas basically. They also can have benefit of this telemedicine platforms where they can consult with doctors through telemedicine, through telephone, through basically video calling, through conferencing. These kind of facilities government is providing basically to the people, where doctors who are expert in Ayush, they are providing basically prescriptions to required patients while they are sitting here in Delhi or any major cities of India basically. This digital expansion is particularly critical in post-COVID era, where movement restrictions hit or have worsened healthcare accessibility. Just imagine at the time of COVID, what happened? Nobody was allowed to go out of their houses, their offices, their buildings. At that time, these telemedicines have helped a lot to people. While they are sitting at home, they have been prescribed special medicines. They're prescribed medicines to have basically to fight back any kind of disease. I'm not talking about COVID only. At that time, a lot of patients were there who were suffering from other diseases, were also in need of medicines, and they consulted with these telemedicine facilities or platforms of government of India basically. The deployment of community-based health workers trained in Ayurveda or Siddha has helped address maternal and child health concerns in states like Tamil Nadu. And that is what widely happened across the India. Global adaptation of Indian systems. This is important how global community is basically accepting or basically trying to adopt Indian health systems. That is what Indian health systems, I'm talking about traditional knowledge systems on health basically. I'm talking about that particular set of knowledge. I'm not talking this modern system basically. International Yoga Day, this is what we all are knowing. Global cultural integration that has happened, that has already happened across the globe. Now almost all the countries are exercising yoga. The institutionalization of International Yoga Day on June 21, adopted by United Nations in 2014, marks a vital step in global acceptance of yoga. 177 countries in one voice they accepted this important practice, making it one of the most widely endorsed proposals in UN history. In 2024, the International Day of Yoga focused on theme yoga for self and society. So yoga is not something very much linked with individuals. That is what goes beyond that. Yoga for self and society, highlighting how individual wellness can contribute to global health harmony. The Indian government launched a global campaign featuring online challenges, transnational webinars, and cross-cultural events. Several UN agencies, including WHO and UNESCO, also promoted the event, showcasing yoga's role in physical and mental health, stress reduction, and community cohesion. This is what happened on this yoga day basically. And the second point is Ayurveda telemedicine in Kenya and Mauritius. That is one of the best example of South-South cooperation. All India's ability to lead basically the countries which comes under global South. And the term has become so popular nowadays. India is keeping itself prepared to lead the countries of global South. India's push for internationalization of Ayurveda has found resonance in Africa, where traditional medicine is both culturally valued and structurally necessary. In Africa, they give a lot of regard to traditional medical practices, basically. That's they are very much inclining Ayurveda telemedicine initiative was launched in 2022 under a bilateral agreement between the Indian High Commission and the Kenyan Ministry of Health. That is what happened in the case of Ayurveda. The collaboration expanded in 2023 to include training modules for Kenyan health professionals on Ayurvedic diagnostic frameworks and herbal pharmacology. Additionally, the Ayurveda Africa Trust, this is also important here, co-sponsored by Indian institutions, is working to establish sustainable herbal gardens in Kenyan rural areas to source Ayurvedic formulations locally. Just see Ayurveda telemedicine, Ayurveda basic in itself. So that shows they have deep faith in Indian, basically traditional medical systems, obviously Indian indigenous system of medicines of medical practices. In Mauritius, where over 60% of population has Indian ancestry, Ayurveda is officially recognized and integrated into public healthcare system. The Mauritian government runs state-sponsored Ayurveda clinics with support from Indian institutions such as Central Council for Research in Ayurvedic Sciences, CCRAS. In 2023, this is another fact I would like to Ayush for island nations. This is what initiative launched by Government of India. Ayush for island nations was announced by India's Ministry of Ayush, targeting not just Mauritius but also Seychelles, Fiji, and Trinidad Tobago, creating an Indian Ocean health diplomacy corridor centered around traditional medicine. So here, traditional medicine is getting attention of those countries which have any kind of connect with Indian ancestry or Indian culture, Indian society, Indian values. The third issue is here yoga for mental health. The UCLA, University of California, Los Angeles, this is one another example. Case study I'm going to quote here. One of the most rigorously studied areas of global adaptation is here at the UCLA David Geffen School of Medicine. Yoga has been formally incorporated into the curriculum of UCLA Integrative Medical Collaborative. This is what important course they have launched in their institution, in their university, basically over there in America. The university launched a program in 2021 known as Healing Through Movement. They launched a very important program there, Healing Through Movement, which combines traditional talk therapy with trauma-informed yoga for veterans, survivors of domestic violence, and marginalized youth. This is already they are practicing there in their university, basically. And that is very much known as yoga. UCLA is also part of global consortium evaluating how yoga-based cognitive behavioral therapy can be culturally adopted in Latin America and Sub-Saharan Africa. Here, another important point is no psychological treatment is being provided to those who are in need. Basically, they're in USA. These adaptations are rooted in India's classical teachings, but modernized through evidence-based models to align with Western psychological standards. This amazing fact here, I would like to mention, like Indian institutions are hesitant when we talk about yoga, they start laughing. No, yoga, कहाँ जा रहे हैं हम? तो ऐसे ही जो आयुर्वेदा की बात करेंगे, उनको लगेगा आयुर्वेदा सब बकवास है. होम्योपैथी बात करो, बकवास है. उनको क्या है? They believe in running after these modern health facilities or medical practices, and that is what we should understand. These the modern system can provide you very unstable kind of way out of this crisis, health crisis. If you want to have a very stable kind of way out of this crisis, and that lies in traditional knowledge systems, traditional medicinal practices, basically that is best solution we have to fight. So that is what very much known as prevention is better than cure, and that is what known as traditional medical system, basically all about. So policy models and health integration, several countries are moving beyond pilot programs toward full-fledged policy integration. In Brazil, Indian yoga and Ayurveda have been included under the SUS. I'm giving example of Brazil unified health system since accepted it as important practice, health practice there in Brazil. A huge number of people are involved in different communities who are practicing this basically there in Brazil. Similarly, in Germany, Ayurvedic consultations are partially reimbursed under private insurance schemes. That has already started taking place globally. Meanwhile, India is supporting global integration by developing the Ayush Export Promotion Council and Ayush Mark, a certification label to ensure safety, efficacy, and equality in international herbal and wellness products. Basically, in 2023, the Indian Ministry of External Affairs expanded its ICCR Ayush chairs. Indian Council for Cultural Relations have introduced this new initiative, basically, which now known as ICCR Ayush chairs to universities in Europe, Africa, Southeast Asia to train future generations in Indian traditional medical knowledge. This is what ICCR is doing globally, basically. These steps underscore India's commitment to knowledge diplomacy. This is what government is developing and playing with other countries, using its health wisdom as a short-cut tool for mutual cooperation. Here, we require to discuss another important component is WHO, Global Center for Traditional Medicine, mainstreaming indigenous wisdom into global health. We have to align our basically indigenous wisdom with global health. That is what required. Our government is working in that direction. In unprecedented move that marks a turning point in global health governance, the WHO inaugurated the Global Center for Traditional Medicine. This is what developed by WHO. GCTM in Jamnagar, Gujarat, India on April 19, 2022. This collaborative endeavor between the WHO and the Government of India reflects a major strategic realignment, one that seeks to mainstream traditional medicine systems into the global public health framework. So, global public India is very much there in global health, public health framework that is getting attention of global health community basically, which was globally. For example, WHO. That WHO has started giving importance and the place to basically this Indian health system, basically traditional systems in their practices, in their policies, in their frameworks. That is getting attention. They're getting place basically. So the GCTM is the first and only global center for its kind. This is also important fact here. This is only global center of its kind explicitly dedicated to traditional medicine. TM, traditional medicine, a term that encompasses a wide range of indigenous and ancient systems, including Ayurveda, Unani, Siddha, traditional Chinese medicine, and African healing systems. So that is getting attention, and all the traditional, practices, health practices are being now considered as important practice by WHO actually. The center is envisioned as knowledge hub, policy incubator, and innovation driver that will position traditional medicine as fundamental pillar in advancing universal health coverage, UHC, sustainable development and health equity. This is what we are talking about. Then sustainable development goals and sustainable and traditional knowledge. I'm going to give you quickly few important sustainable development goals, which is going to be linked or associated with basically traditional knowledge. Traditional knowledge is the foundation of indigenous peoples' identities, cultural heritage, civilizations, livelihoods, and coping strategies over several centuries. The crucial role of indigenous knowledge in achieving SDGs and for addressing the most pressing global problems is gaining international traction. It can be useful in achieving the following goals. One, SDG 1, no poverty. Integration of medicinal plants can contribute to better livelihoods and eradication of poverty in all its forms. SDG 1. SDG 3, good health and well being. Traditional medicine can help in achieving better health outcomes by making healthcare more equitable and affordable. SDG 4, quality education. Traditional medicine holds a wealth of knowledge that can be passed down through generations. SDG 10, reduce inequalities. Traditional knowledge can lead to reduced inequality by making healthcare more affordable. SDG 15, life on land. Increased use and demand for medicinal plants can lead to the standing forest and its biodiversity being recognized and valued. SDG 17, global partnership. Traditional knowledge can foster partnership by encouraging collaboration and the exchange of knowledge and experience. To make the process of sustainable development feasible and operational, it is important to establish a common focus that can integrate the outlook and efforts of various participants in development, such as indigenous people. So, what is the way forward of this entire discourse? Basically, I'm going to conclude soon by saying that integration of traditional modern medicine in global health, India can bridge the gap between traditional and modern medicine, offering a holistic approach to health governance. And that is what we are already experiencing here in India, with its rich heritage in Ayurveda, yoga, and other traditional practices. India has promoted the concept of one health. So here we can't distinguish like this is modern, this is old. All the practices are known as one health. And that is part of that campaign of one health, basically recognizing the connectedness of human, animal, and environmental health. This is also important here. All the health are important, whether that is of humans, that is of animals, or that is of environmental, basically. This integration is particularly relevant in addressing non-communicable diseases and emerging health issues. The IU's guidelines, along with traditional remedies for diseases like filariasis, underscore India's contribution to global health practices. Facilitating digital health and health technology. India's advancements in digital health infrastructure, particularly through initiatives like the Ayushman Bharat Digital Mission, provide a framework for global health innovation. By sharing e-health solutions globally, India can help other nations improve their health information exchange and telemedicine capacities. Capabilities basically. This integration of digital health into public policy makes India a leader in tech-enabled health governance. India offered COVID as a digital public good to the world, asserting that it is committed to sharing its digital health expertise, expanding health cooperation through global south engagement. This is what also required to be done from Indian side. India's role in global south enhances its capacity to shape global health governance by promoting south-south cooperation. India fosters stronger diplomatic ties and positions itself as a champion of equitable health solutions. India's vaccine Maitri initiative, that is one of the best example to give here to basically all of you, provided millions of vaccine doses to South Asian and African countries, is strengthening India's influence in these regions. So in that way, it can be said like we have been successful, what we have desired, what we have aimed for basically. In COVID-19 crisis times, we have done tremendous work where there were several countries which were very much, for what vaccine nationalism kind of philosophies they developed at that time. But the government in India was there to say, like, in whatever vaccine India will develop basically to fight against disease, this COVID-19 disease, India will provide to global community. And that is what government of India has done. India was struggling here. At the same time, India was providing medicine to its own people, and has provided medicine to other countries free of cost. Which countries which were in need basically, free of cost to those countries which were not able to buy or purchase basically medicines or vaccines here in India, like African countries, South Asian countries, Southeast Asian countries. And at the same time, India provided these vaccines to all those countries which are so-called developed countries, which were not ready to share their information, their vaccines, their facilities in the name of vaccine nationalism. So that's what kind of philosophy you have. And India's philosophy is very much clear. India believes in equitable global health system, basically, where all the people, all the individuals who are present on this earth should be provided basic amenities without having any kind of second thought, without having any kind of discrimination. If those countries which are having facilities are not providing basically assistance to those countries which are in need, it means there's huge inequality. That called basically discrimination. So India is very much clear in that vision. These kind of facilities should be provided all people. That's why we believe in Vasudhaiva Kutumbakam kind of philosophy, where we consider global community as a family. If a part of family is unhappy or in need of basically such things, we can't be happy. So that is what the philosophy of India. So India have been successful, and India have provided a path basically. India has shown the path to global community to be equitable in basically, and that only can be done through this traditional knowledge system. Or with these, I'm stopping here, and I would like to have questions, queries from your side. Sorry, I've exceeded the time. Almost 5 minutes. Thank you. Thank you so much.
Am I audible now?
Yeah, you did.
So thank you so much, Professor. It was really very, a lot of information you have provided to us, like what sort of the Indian knowledge system based practices are ongoing in other countries. And it is very important. That's the reason the title was being designed, that what sort of the global health equity is through India's like knowledge system.
Wisdom, yeah.
System can be applied. So I request the audience, the participant, so please ask any question from the professor if you feel that yes, this can be asked related to the health equity. So professor will give your answers. Anybody from the audience, please.
किसी को कोई सवाल पूछना है without having any second thought, do ask.
Agitate,
Query कुछ भी.
ask, please. This is very important you to understand the health equity. Yes, Anupam, please go ahead.
Hello, sir. Good evening. Am I audible?
Yes,
Yeah,
yes.
yeah. Go on.
Anupam, please.
Sir, there are lots of misinformation around traditional medicine.
Yeah.
Like there are some unscientific claims like cow urine can cure cancer. These kind of misinformation can harm public trust and health. So, what steps can government take to counter such narratives while still promoting this India's genuine traditional wisdom and If such steps are possible, why do we not see them are being not implemented or assertively so far?
Yeah, that's very important. Actually, that is misinformation. Government of India never says that actually. So you should understand, if you want to have no consultation with those experts who are working in this ayus, you should go to them rather running after social media kind of thing.
Yes.
If you're running after social media, you'll find out such fuzzy news. So it's better to avoid or ignore. Be smart, be intelligent, be sincere, follow the doctors, the experts. If you think there's not an expert of Ayurveda, there's no expert of yoga, I know, homeopathy, then you are wrong. There are a lot of people who are expert. They are studying, they are doing MBBS in that. So go to those hospitals, those doctors who are expert, rather taking news of taking basically reports, or basically taking videos or seeing videos from social media platforms and start following them. Though these kind of things are not being promoted or protected by government of India. Government of India always says believe in authentic sources. We have very much dedicated Indian Institute of Ayurveda Sciences, like just like AIMS. Why don't you consult to them? They'll provide authentic prescriptions. So these kind of things we are required to discourage. We required to basically avoid, ignore. That is best way. Even in modern medical systems, you will find out a lot of prescriptions and which are useless. There's no use of that that particular prescription, but people start believing in that. People start following that. For that's why doctors usually uh, says that if you have any problem, medical issues or any problem, you should go to hospital. You should consult with doctors who are expert in that. Don't go after these newspapers and these social media platforms, or basically these kind of rubbish informations which are available on easily available on this websites. So we should ignore that. So whenever you find such kind of situation, you try to go to basically genuine, authentic, recognized hospitals. Yes.
Yes.
Thank you so much, sir.
Anybody else, please?
Mm.
Anybody else from the audience, please? Can raise your hands. We can see your hands are being raised. So, is there anybody who has worked with us? I think there are a lot of interns who has already worked with us. So they have Anupam already worked on the health aspect as well. So that's the reason he was having question. So anybody from the audience, please can ask the question. Sir is here to answer your question.
Good evening, sir.
Yes, yes. Good evening.
Good evening.
Good evening, sir. Myself, Dr. M.S. Aggu.
Yeah.
Yeah, I want to ask one question, sir. Can we declare it as a substitute of allopathic system? Sir, my
No,
question is very
that is
simple.
what
That
we are
can
discussing
we
actually
declare
here.
Ayurvedic system as a substitute of Ayurvedic system, allopathic system?
Allopathic system, that is what we are talking, no?
Yeah.
Traditional knowledge system or Indian knowledge system on health facilities, health practices. And that is what we are. I have, no, in between, I have said one thing like prevention is better than cure. So, what is prevention? Have a very, uh, disciplined life. That is the most important thing, right? If you are practicing a healthy
Yes, yes.
lifestyle, you will be free of diseases. That's so simple. You'll never need to go to hospital.
Yes.
Those who practice these kind of things, believe me, go to your village, go to villages basically. You'll find out a lot of people who are living like 100 years
Yes.
without any kind of problem. Why they're living? Because they are taking food at 6:30, they are sleeping at 8, waking
Yes,
up at 9, 4 a.m. They are having walk, they are doing physical work, and they are fit. What kind of lifestyle
yes,
we
yes, yes,
have
yes.
nowadays? Just see, we all are. I'm not talking about you. I'm not talking about myself. It's the case of everyone who lives in city. Very less number of people who exercises that rural kind of practices in city, urban areas. Very less.
Yes,
But
yes.
you'll find out in just go to park, you'll find out people running at 4 a.m. or walking at 4 a.m. Even in cities, I'm talking about. There are people who are used to have dinner at 6:37, even in cities, I'm talking about. I have met few other people. They are very disciplined. They are used to have breakfast at 6, 7 morning, heavy breakfast, lunch at no 12, 12:30, and thereafter no food, nothing. And they are so fit. Their face no glows. They don't have any problem. You'll find out a lot of people who work till 2 in the night and they wake up at 11.
Yes.
They start having breakfast 12, lunch 5, dinner again 11, 12. So that gives a lot of strength to your body basically. That is the biggest cause of disease. No? That is biggest cause of health problems. So lifestyle is becoming hell for basically global community. And that is what we have followed. We have followed from West. Believe me, the lifestyle there in West is quite different. The sunrise there is different. The timing of sunrise and sunset is different than our country. And the sunrise and sunset here in India is different from other continent. So the lifestyle is different there. We don't require to follow their lifestyle. And
Yes.
once you start following their lifestyle, we'll experience such problems. They are okay because they have different kind of system.
Yes.
But we are
Thank
trying to
you,
copy
sir.
them. Yeah. So that
Thank
is
you, sir.
problem.
Thanks a lot,
Thank
sir.
you.
Yes.
Saraswati Karkata has texted, I think, people should have more choices, better choices, informed choices. Yes, very true, very true.
Yes.
So traditional,
Saraswati is very much known to me.
yes,
She's a
yes,
good
yes.
junior of mine from JNU.
Okay, okay.
And she's also expert of health issues.
Okay, great, great, great. So really welcome, like we are welcoming on behalf of the BNSK to be here. So thank you so much, Professor, for giving this valuable insight. It will really help the audience to understand, even us to understand what sort of the practices should be there and what case studies are there, right? So we need to adapt, and we are forming the integrated model, including the health, environment, and livelihood. We are trying to launch the pilot project as soon as possible, so this will be really very helpful for us. And thank you so much for giving your valuable time. And again, I requested many times we postponed this episode. We planned earlier that this will be the third episode, but yes, now it is the sixth episode. So no worries. So we are going to have more episodes with you in the future. So thank you so much.
And that is what Aman, I would like to accept here on this platform. That is my fault. Even Aman approached me earlier to deliver my ideas, views on this very important topic earlier, but I couldn't, uh, deliver that at that time. I delayed it basically technically. I'm sorry for that, Aman, and definitely I'll be happy to be part of your
Yeah,
future initiatives.
yeah,
And at that time, I will be the first one.
yeah, definitely, sir. Definitely. Thank you so much. Namaste. Namaste.
Thank you so much.
Okay.
Thank you.
Yes, yes.
Okay,
Thank
thanks
you
a lot.
Thank you so much. Yes.
Thank you.
Yes, yes.